Hello students, last class we have studied about the meaning of health, the various types of diseases, what are the causative agents, the infectious agents, and also we have studied about the mode of action of antibiotics. So, let's proceed to the next part of the chapter, that is why do we fall ill. So, in today's class you are going to learn number of things like you will be able to define vectors as a means of spread of disease. Also, you can explain the working of immune system. You will be able to learn how to classify the different principles of treatment, and also you will be able to analyze tissue and organ specific manifestations and create flow chart to show the point of entry and the different organs affected. So let's start today's class. So we'll be here continuing from the previous, we'll be continuing now with the different means of spread of diseases. So what are the different means of spread? Most of you know the different means, such as all of you know, if you inhale contaminated air, or if you drink contaminated water, if you take contaminated food, definitely you are going to suffer from different infectious diseases. Then some other means of spread are also there, such as direct contact like handshake. Indirect contact means using the clothes or the utensils of an infected person. Then the last one is vectors. What are vectors? You know, vectors are the carrier agents, carriers. So they directly do not cause the disease. Suppose female Anopheles mosquito. It bites the healthy female Anopheles mosquito. When it bites an infected person, means a person having malaria, right? Then the mosquito itself gets infected, and the disease causing agent, that is the plasmodium, the protozoa, enters into the female Anopheles mosquito. So now this mosquito is an infected mosquito, and when that infected mosquito bites a healthy person, then what happens? The plasmodium, that the causative agent of malaria, that enters from the female Anopheles mosquito, from the infected female Anopheles mosquito into the healthy person, and then that healthy person suffers from malaria, means he is getting the disease. So vectors are carriers of the diseases. So they are an important means for spreading diseases. Then another is body fluids. So you know, blood. During blood transfusion, very much care or precautions should be taken. Why? Because when a donor is donating blood to a recipient, if the donor is having some infective agent, suppose the donor is having HIV virus, the donor himself is not knowing that he is having AIDS, and when the blood is collected from the HIV donor and it is transfused or transferred into a recipient, a healthy recipient, then definitely the AIDS virus, the HIV virus will enter into the recipient's body or not, and the recipient will then suffer from AIDS. So here utmost care must be taken during the transfusion of blood. So blood is a body fluid through which there can be spread of diseases. Also other body fluids like your lymph, then semen, they also play an important role in spreading different diseases. So before going to which organ acts as the entry, you must see one picture where you can very easily understand the different means of spread. So here all the means of spread are represented in this picture, and the last one you mark, there is a dog. The dog is, it's a rabid dog, right? So here it is having rabies virus that can enter into any person to whom, or any animal to whom this dog bites. So through the bite of the dog, the saliva enters into a healthy person, and that saliva contains the infective agent. So that's a rabid animal, and here through the dog bite the infective agent is transferred to a healthy person, making him diseased. Now we'll study about organ specific and tissue specific manifestations. So you'll be able to understand the meaning when I will give some examples. So first of all, how do these microbes or these infective agents, these pathogens enter our body? How they enter our body? So there are some entry points. Let us take the example of nose. Okay, any microbe can enter in through the nose, because when we are inhaling air, the microbes are there in the air, and with air they are entering in through the external nostrils. They enter, then they enter into the nasal chamber, then the pharynx, larynx, trachea, then lungs. Understood? So through the nose they are getting the entry and affecting which organ? Lungs. Then any disease where the lungs is affected, one of the very common disease is tuberculosis. So just you imagine how the entry point is deciding the type of disease here. Similarly, take the example of mouth. Through the mouth also the disease causing agents can enter. So where they will move? From the mouth they will go to, mouth means your oral cavity or buccal cavity, then pharynx, then they will enter into your food pipe, esophagus, then the stomach, then small intestine, large intestine. Got it? So that is your alimentary canal. They enter your alimentary canal or gut. So any such example, you can take the example of typhoid causing bacteria we have discussed, salmonella. So when you are taking contaminated food, suppose street food you are taking and proper hygiene is not maintained, okay, and that salmonella bacteria is there in the food item. So after consuming that food, the bacteria enters through the mouth, it is entering, then it will enter and infect your intestine, and then you will be suffering from typhoid. Similarly, from the mouth it can also enter into liver, and then it can cause a serious and severe disease, that's a jaundice. So here the point of entry is deciding the type of disease, or it is affecting which tissue, which organ, that is decided by the point of entry, and accordingly you have disease symptoms or the manifestations of the disease. Similarly, sometimes suppose female Anopheles mosquito, it is biting, it is sucking blood through the skin, the disease causing agent is entering. So skin here is the point of entry. After entering, it reaches the blood. From the blood it goes to each and every cell of our body, or not. Even it can go to brain. So it can cause brain malaria, Japanese encephalitis, very dangerous form of diseases. So here you just mark the entry points decide the organ which will be affected, and the organ affected again decides the disease, right? But is it always true that the entry point decides? It is not always true that only the entry point will decide what disease will occur. So what are the target organs? Suppose we have discussed about liver, jaundice. Brain can be the target organ. It is your alimentary canal, it is the small intestine which is the target organ. So understood the meaning of target organ? Entry point, then which organ is ultimately targeted or which organ is infected. So you see, it is entering through mouth, it is not infecting the mouth, but it is infecting your intestine, right? So here the target organ is intestine. If it is targeting your lungs, entering through nostrils but affecting the lungs, so here the target organ is lungs. Accordingly there will be symptoms. Suppose lungs, then what could be the symptoms? There may be cough, sneezing, coughing, breathlessness, like this, difficulty in breathing, okay. So and there may be infection in the alveoli of lungs. So very severe form of disease can occur if lungs are affected. Now you see, this coronavirus mainly affects your lungs and there is breathing difficulty. So you have oximeter, usually you are advised to have oximeter and to measure the oxygen levels, right? So if the proper level is maintained, then it's okay. If the level is not maintained, then you have to consult a doctor immediately. Then Similarly, if brain is the target organ, then you could have some symptoms like you may have headache, vomiting, fits, unconsciousness. So in addition to these tissue specific effects, also some common effects are there, and they depend upon the ability of your immune system. So here comes a new term, that is immune system. So this immune system is there to provide protection to you against the entry of these disease causing agents or pathogens. It provides you immunity, it provides you resistance, it provides you protection against the disease causing agents. So your immune system should be a healthy one, right? A healthy immune system definitely will protect you from a number of diseases and will keep you healthy. So what is an active immune system and what is its function? Active immune system employs many cells to the affected tissue to kill off the disease causing pathogens by a process called inflammation. So when a pathogen enters your body, you see immune system has a special ability to distinguish between self and non-self. Means whether that agent is belonging to your body or it has come from outside. Anything foreign, it can easily distinguish. Immediately it can know whether it is from your own body or it is from outside. So when an outside agent is entering into your body, it is easily or immediately recognized by whom? By your immune system. Then it starts its work. What is the work? It will employ certain cells, okay? Certain means antibodies, B cells and T cells to that affected tissue to kill off the disease causing pathogens. And that process, which is started off by the immune system to give you protection against the disease causing agent, is called inflammation. So when inflammation is going on, there will be some local effects such as swelling, pain, then general effects like fever. Okay. So when we are suffering from fever, usually we say that I am not feeling well or I am having high temperature, I should go to a doctor and then take some medicine. But you must know that sometimes this fever means increase in temperature, swelling and the redness. Okay, suppose there is a wound here and there is this area there is swelling is there and redness is there. Okay, and also that area is little bit having more temperature than the other areas. This indicates your immune system is working, the process of healing is being carried out. So you should give opportunity or chance to your immune system to fight with the disease. But nowadays we don't have patience, right? Whenever a simple fever is there, immediately we take medicines. Okay, we are not giving chance to our immune system to recover from that disease or that pain. Got it? So if you are giving chance to your immune system becomes more and more stronger. So immune system has the ability to send certain cells to fight with the disease causing agent. Now let us talk about HIV infection. What happens? You know, HIV stands for Human Immunodeficiency Virus. HIV virus causes HIV AIDS. The disease is called AIDS, AIDS, Acquired Immunodeficiency Syndrome. So here the HIV virus enters the immune system, attacks the helper T cells and damages the defense mechanism of the body. So just imagine how powerful this HIV virus is. Our immune system is having number of cells like we have B cells, T cells. Okay, the B cells they produce antibody and those antibodies they fight with the disease causing agents. Now but in case of AIDS virus, what happens when this virus enters? Okay, directly it will affect the helper T cells. So you know helper T cells they help the B cells, the bone marrow cells, T for thymus, B for bone marrow. They help the B cells or the bone marrow cells to help the bone marrow cells or the B cells to produce antibodies. Those antibodies they fight against different types of pathogens. But here their target is helper T cells. Once they attack the helper T cells and infect it, then the helper T cells there will be gradual decline in the number. So Who will activate the B cells to produce antibodies? If the T cells are reduced. Got it? So there is reduction in the helper T cells, or the count of T cells decreases. As a result, the antibody production also decreases. What are antibodies? Antibodies are protective proteins. They provide us protection against the disease causing agents. So if we have less antibodies, definitely the protection given will be less, means our immunity decreases. Our immunity, our resistance power decreases if our helper T cells are attacked and damaged. So who is damaging it? It is HIV virus. So here you see our immune system is unable to fight with the HIV virus. So what happens here? Such patients are unable to fight and resist many minor infections that we face every day. You see, when you are going outside, every day in the air, okay, we are taking, inhaling air, that we can't prevent. So any type of pathogen can enter. Got it? So we are not getting disease every day. That means we are having a strong immune system. That's why we are not getting the disease. However, some other persons get some diseases. But if a person is suffering from AIDS, then he or she will be suffering from every type of pathogen who is entering will cause the disease, because the body is unable to provide, the immune system is unable to provide the adequate defense or protection. So if there is common cold, it will gradually lead to pneumonia. If there is a TB, tuberculosis is there, nowadays TB is curable, we are taking medicine and then you are getting cured. But if the person is suffering from AIDS, then TB is also not cured. Minor injury or cut there, we are taking antibiotics and we are getting cured, but that person suffering from AIDS will not be cured. So just imagine, the body of the AIDS person becomes a storehouse of number of diseases. Got it? So number of symptoms will be there. So that's why the word syndrome is used. Acquired immunodeficiency syndrome. It's a collection of symptoms of different diseases. So immune system becomes very weak and unable to provide defense. So here we can conclude here that immune system determines the number of microbes surviving in the body. Why and how? You see, if you have a strong immune system, then you are fighting with the pathogen and killing them, thereby reducing the number of the pathogens, the disease causing agents. But if you have a weak immune system, then you are unable to fight with the microbes. That efficiently you cannot fight. So the number of disease causing agents or microbes will increase in your body. They will multiply, they will grow, multiply and increase in number. So which one decides? It is your immune system which determines the number of microbes that survive in your body. And again, if the number of pathogens is large, then definitely their effect will be more pronounced. If the number of pathogens are less, their effect will be less. Got it? So here the severity of the disease depends on the number of microbes. If the number of microbes, number of disease causing agents is very large, is high, because your immune system is unable to provide the adequate amount of protection. So they are getting the chance to grow, to live, to survive, to multiply, to increase their number, right? So and then you are suffering from the disease. Hence the severity of the disease depends on what? It depends on the number of microbes. So the disease is very dangerous if the number of microbes is more, and it is less dangerous or it is mild if the number of microbes is less. So now it's time to understand what are the different principles of treatment. Okay, all of you know what is treatment. When treatment is taken? When already you are suffering from a disease, then you go to a physician, then he will listen to your symptoms, signs, and then may ask for some diagnostic tests. Then he will prescribe you certain medicines, right? So that is the treatment. So in what way the physicians, they provide treatment? There are two methods of treatment. What are those? Means you see, one is symptom directed. Means sometimes you must have marked some doctors you like to go, because once you have gone to the doctor and he has given you certain medicines, and immediately, means after taking the medicines, within few hours or within 1 day, 1 to 2 days, you are getting complete relief from the pain which you were having. Got it? So definitely you will like that doctor, you will appreciate that doctor, that his medicines are really working. Okay, so what he has done, he has reduced all the symptoms, means all those discomforts he has reduced by giving certain medicines. So this treatment is called symptom directed treatment, right? Now the other method is, suppose you have gone to another doctor, he is giving you medicines and he has prescribed you to take a course of antibiotics, and that you have to uh, continue, suppose for 15 days, and regularly you have to take the antibiotic, and certain means inhibitions on your intake of food, like don't take much of oil or rich food, that sort of inhibitions are also there. And what you find, first day you have taken, second day you have taken, the pain is not reducing immediately. Got it? You are not getting relief immediately. So gradually, very little amount, the pain is getting reduced, and after taking for 15 days, gradually you are getting recovery. So definitely you will say, why I will take medicine for 15 days, why not within 2 days I will get relief so that I can do my normal work. So you will definitely prefer to the first type of treatment, that is the symptom directed treatment. But one thing you must know, that the symptom directed treatment, in that case the infecting microbes will not be killed and the disease is not completely cured. It may happen that after some 6 months or 3 months, like that, you may again get the disease, because that treatment has not completely killed all the microbes. Some microbes are still left. Okay, those microbes will again grow, multiply, increase in number, and again cause the disease. Got it? That is symptom directed disease. However, in the second method, that is to kill the cause of the disease. So here the treatment involves killing the pathogen, complete killing of the pathogen, right, which causes the agent. So here there is complete recovery from the disease, and in this case you have to complete the whole course of antibiotic and you have to obey whatever instructions the doctor has given. So the two methods understood, one is symptom directed, another is to kill the cause of the disease. So now we will be discussing about the making of the antiviral. Yes, we have already discussed antiviral drugs, how they are very difficult to make compared to that of antibiotics. Antibiotics the doctors will prescribe only when there is infection, and that antibiotic can really kill the pathogen. Now, so let's go to the principles of prevention of the diseases. So we have two different principles of prevention, and here we'll before going to principles of prevention, I'd like to ask you a few questions that already we have discussed. So let us now discuss some questions. So test yourself. Number 1, which one of the following is not a viral disease? The options are dengue, AIDS, typhoid and influenza. So here the answer is obviously typhoid, because typhoid is caused by bacteria Salmonella typhi, that already we have discussed. The next question, which one of the following is not a bacterial disease? Cholera, tuberculosis, anthrax, influenza. The question is not a bacterial disease, right? So here you see cholera, tuberculosis, anthrax and influenza. So here influenza is caused by virus, that's why the answer is influenza. Which one of the following disease is not transmitted by mosquito? The options are brain fever, malaria, typhoid, dengue. Which one of the following disease is not transmitted by mosquito? So definitely here the answer is not transmitted by mosquito is typhoid, because brain fever, malaria and dengue, these are all through the vectors, mosquito vectors. Which one of the following disease is not caused by bacteria? Typhoid, anthrax, tuberculosis, malaria. So you must be knowing here what are the causal organisms. Typhoid bacteria, anthrax bacteria, tuberculosis bacteria. And malaria is caused by protozoa, plasmodium. So definitely here the answer is D, malaria. Then the last question, which principle of treatment is better and why? Just now we have discussed the principle of treatment in which there is to kill the cause of the disease. That is the better principle, not that principle which is associated with the symptomatic treatment, only to reduce the symptoms of the disease. That is not actually curing you. You are not completely recovered. So the principle of treatment in which there is use of medicines where the disease causing agent is completely killed and you are getting complete recovery, that is better. So students, I hope in today's class what you have understood, that will definitely help you, and that has made you to understand certain things, so that you can be able to, now you are able to define vectors as a mean of spread of disease. Also you are able to explain the working of immune system. You can classify principles of treatment. Okay, now you are able to analyze tissue and organ specific manifestations, and also you can create a flow chart. Okay, means the sequence of events to show the point of entry and the organs affected. This will definitely help you to understand the actual causes of the diseases and the effects, how our organ system and body system are affected and how do we suffer. So this is definitely going to help you. Thank you all that much for today's class.